Welcome back, everyone. October is Breast Cancer Awareness Month, and today joining us, we have a doctor from the Medical Center, the Breast Cancer Health Clinic. Thank you so much for joining us, Dr. Diego Cabrera, Hematology and Oncology Specialist at the Med Center Health Breast Clinic. Thank you so much for joining us.
Thank you for inviting me.
Well, first, can we just kind of dig into what October is meant to raise awareness about? Obviously breast cancer, but specifically for women, because obviously the rate is a lot higher for women.
Of course, this is a very important issue. As a matter of fact, in America, we diagnose about 260,000 cases of breast cancer a year, and 40,000 die a year. So, as you can imagine, this is a very important topic. In order to improve our numbers, mortality, to improve it, we need to diagnose cancer early. Diagnose breast cancer in an early stages of utmost importance. And the best way to do that is to screen.
Okay.
Screen for breast cancer through a mammography.
So how young are we talking? Because I know that I've heard so many numbers over the years, it goes up and down, but you know, they say the younger the better. But what is the age that you should start getting them?
That's an excellent question. I mean, 10 years ago, we started at 50 years of age. Currently, we are recommending between 40 and 45 years of age to start your screening mammograms. And it depends on risk. For example, a family member, a patient could have a family history of breast cancer, and that number may change. So, you know, we ask them to talk to their doctor, and they can provide the directions. Yeah. So
why do you think the number has gone down some? Is it just because younger women or men too are getting diagnosed at a younger age?
Yeah, I think you're absolutely right. There's been a shift.
Okay.
And genetic and environmental. And here in Kentucky, we can get a big taste of it. I mean, I cannot tell you how many young women I diagnosed on a monthly basis in their 30s, 40s, and 50s. So, yeah, it's most important to do your screening. Yeah.
Well, I know it's all relative, but how treatable is breast cancer from
early breast cancer? The cure rates are very high, 80 to 100%. You know, they're very high. So that's why it's so important to catch it early. When it's advanced or the cancer has spread, it becomes more difficult. Although science has evolved tremendously in the last 10, 15 years. So we're able to take care of people in spite of their stage.
And so here in Bowling Green, people can get, men and women both can get the treatment that they need here in Bowling Green. Can you talk a little bit about the services that you provide there at the center, at the Medical Center campus?
Thank you for that question. I think before I joined, I thought the need for better care here in the community. To give you an example, a woman can feel a tumor in her body and go by 2-3 months without treatment. Maybe a month before diagnosis. We have developed the breast clinic at Med Center, which is all these specialties joining together to help breast cancer patients. We can get diagnosis within days and get patients to treatment within a few weeks, maybe less than that. So we have expedited care tremendously. And as you can imagine, patients, when they have a tumor in their bodies, they have tremendous anxiety.
I can't imagine.
Yeah, I mean, it's weeks and months with it. So we have improved that tremendously. But not only that, we also, with our partnership, Med Center with a partnership with the University of Kentucky, we provide genetic assessment for patients who have increased risk of cancer. They have a family history of cancer, whatever that is. They can get a genetic assessment locally with us. And let me tell you, patients do not need to travel far for any kind of treatment. We do it in-house.
I've heard that so often, just with, you put so much stress on your body being sick in the first place, the anxiety of being sick, and then having to travel elsewhere for care. How important is it just to be able to go down the street and get care? I know I've talked to, you know, cancer patients, cancer survivors, and they say that that's pivotal.
It's extremely important. I mean, New York Times reported call it the cancer commute. So people in underserved areas like ours have to travel 50, 60 miles for a simple treatment that you get around the corner.
Right.
So here at Med Center, we offer surgical treatments, radiation treatments, hormonal treatments, chemotherapy, everything is available. We are actually starting clinical trial office.
Oh, wow.
So
That's
things
big.
that are, it's big news. So things that are usually available at bigger centers in a bigger city, we're slowly bringing it in here in Bowling Green.
Well, we'll make sure we get all this information up on our website so people can go on there and get the information further on your website as well. Thank you so much for being here, and thank you for all the care that you give here, people in Bowling Green. We really appreciate it.
My pleasure.
Well, we'll make sure we get all this up on our website for you. We'll be right back.